नमस्कार दोस्तों, मैं डॉक्टर अनिल कुमार, फाउंडर एंड प्रेसिडेंट हेल्थ केयर स्किल्स फाउंडेशन। कंटिन्यूइंग विद आवर लर्निंग वीडियोस फॉर हेल्थ केयर वर्कर्स। एक बहुत ही इंपॉर्टेंट कंपोनेंट्स है फॉर ऑल दी हेल्थ केयर वर्कर्स, स्पेशली दी नर्सेज। ओवर अ पीरियड ऑफ टाइम वी हैव been seeing lot of things which a nurse is actually performing bedside with their skills, with their knowledge, with their vision, or with the need of the patient. They have been doing small things about the patient care, about the medication, about the monitoring, about administration of fluids, drugs. बहुत छोटी छोटी चीजें a nurse is actually involved in terms of monitoring, picking up things early, detections of complications, monitoring critical alerts, handling patients, handling lines, handling drugs, whatnot. So huge amount of credit to all the nurses for wonderful support in overall improvement of the problems or overall improvement in the survival, decreasing the morbidity and the mortality of all the ICU admitted patients. So big regards to all the nurses for their wonderful job. But in this video, we are sharing, or I'll be sharing 10 common mistakes what a nurse could avoid to improve the outcomes or improve the mortality or the morbidity associated with the healthcare care of a critically ill patients admitted to ICU or emergency. These are small observations over a period of time which I have gathered, and there is no personal research on this, but this is my views about the topic. I personally feel these are 10 to 12 common mistakes what a nurse can improve on. So beginning with the first, I feel, is the inadequate hand hygiene. As a nurse is involved in many times, or more than a doctor, more than any healthcare provider. Nurse is actually involved in lot of processes of handling patients, handling lines, handling handling lines, central lines, sampling, Foley's catheter, monitoring equipments. So a lot of time you are actually touching the patients, you are touching the files, you are touching the bed railings, touching the monitors, zeroing, handling bed sore, lot of things. So hand hygiene is one integral component which actually going to change the outcome. So I request each and every nurse to follow hand hygiene to a strict compliance. Although you have been doing, there is always a benchmark to achieve. But with the increasing demands of critical care beds, we are actually difficult to decrease or improve the compliance, because as the need increases, you are seeing one staff to two patients, one staff to three patients. So that is the area where hand hygiene is equally more important to avoid the cross infections with the avoidance of hand hygiene. So one is we must practice hand hygiene to best possible extent. Second is wrong patient and wrong procedure errors. So as a nurse, we should identify which is the patient, which is the procedure planned, which is the site procedure is planned. Also, we have to ensure the reports of the right patients are in the right folder, right X-ray with the right patient, because a lot of times we have realized X-rays has been mislabeled, X-rays has been exchanged, some lab reports have been interchanged with different patients. So that is also where we need to improve, because a doctor is looking after many patients in the same ICU. As a good nurse, we must ensure the identification tags of all the investigations, the lab reports, as well as if any procedure is planned, we have to ensure the site as well as the site preparation. So we can avoid this wrong patient and wrong procedure errors. That is also one. The next mistake, what I commonly feel, is incorrect medication preparation or administration. This is very common in our intensive care practices. One is the delay in administration of antibiotics. Second is there is a way to deliver that antibiotics, because most of the time some antibiotics are given as a small bolus in 1 hour, and some antibiotics are to be given as infusion over 4 hours. Even the amount of dilution and the concentration at which these infusions has to be given, that also is very important to avoid miscalculation, to avoid catastrophic events, especially with the drugs which needs appropriate dilution. So every ICU and every nurse should ensure there is a drug dilution chart which has to be little structured and little standard, so that each and every nurse follows this similar dilution, and we get a fair idea like 1 ml will be this much of milligram or this much of microgram. So this will also avoid the administration errors. Second thing, similarly, the blood product administration is also one area where we have to be little particular about the matching, cross matching, detailing, as well as to avoid any complications associated with the blood transfusion. We must pick blood transfusion reactions early as a good nurse. So that is one area where we can improve. Also, to ensure when we are giving blood or blood products, we can stop IV fluid administration that particular time to avoid fluid congestion, as blood and blood products can also lead to congestion. So avoid giving simultaneously fluid or any other component to avoid overloading or pulmonary edema or TRALI associated with the blood transfusion.